Dr. Jackson, how much weight have you suggested the president lose? And he has not exactly been enthusiastic about exercising. The president kind of believes that we all have a finite battery. Why waste it on exercising when you can put it toward other pursuits? So what did you counsel him about that?
Thank you, Dr. Jackson.
Yes.
Thank you. 2 questions for you. Number 1, there have been some questions as part of your exam. I'm wondering if you talked to the president about this, about the president's mental fitness. He has pushed back on that, calling himself a staple genius. Can you assess the president's mental fitness for office?
Absolutely.
To follow up, the president's personal doctor memorably said during the campaign that he would be the healthiest individual ever elected to the presidency. Do you agree with that assessment?
Dr. Jackson?
Yes.
There was an incident recently where the president appeared to slur his words while giving an address. Did you look into what the cause of that might have been at all?
I did, yeah.
Some people have suggested that could be related to dentures. Does the president wear dentures?
He does
mentioned the
not.
dental exam.
The president has no partial or indentures of any kind.
Dr. Jackson,
Yes.
I'd like to ask you 2 questions. One is about the ejection fracture.
Right.
My wife suffers from that, so that I clued in on 60%. Is that a concern going forward for him? Is because that in some cases indicates low activity?
No, not at all. 60 to 65% is a normal ejection fraction. That's not. There's no concern about that at all.
Second follow up on the cholesterol, over 220. Do you hope to get it under 200?
Well, we're.
Dr. Jackson, thank you. Could you just elaborate in layman's terms if possible, and you've been doing a great job at that, what you ruled out in these cognitive tests? There have been reports that the president has forgotten names, that he's repeating himself. Are you ruling out things like early onset Alzheimer's? Are you looking at dementia-like symptoms? And then a second question, a lot of doctors at the back end of a physical like to give their patients tips before they walk out the door, things that they should change in terms of lifestyle or behavior. What did you tell this president outside of diet that he might want to change?
Pretty intensive tests, including a CT scan of his chest and a transesophageal echocardiogram.
No, it was a transthoracic.
Transthoracic.
Yes.
Did he need to be sedated at all, or was there something you were worried about specifically in getting the CT scan?
No.
Let me ask a question that follows on the philosophy of the fitness of the president.
Yes.
The 25th Amendment, a lot of people in the country have been talking about it. It basically contemplates that a group of Senate-confirmed laymen will weigh in on whether the president's able to discharge the duties of the office. You, as the president's position, have certainly given this some thought over the years that you've been in your role. On what basis would you, and this is just a philosophical question, advise the cabinet that the president is unable to discharge his duties? How does that bar get met?
Dr. Jackson.
Yes, I'm sorry.
So you talked about dealing with President Trump on a daily basis. Can you talk a bit about him as a patient, like what type of patient he is? Does he take all of your advice? And you also talked about, since you were dealing with him on a daily basis, has he had any ongoing ailments or anything like that? You talked about giving him Sudafed. Sometimes it sounds like he has the sniffles when he's talking. Like, does he have any allergies or anything like that?
He does.
Jackson, just to make sure we're clear on this, when you analyze his cognitive ability or his neurological functions, that is not the same thing as a psychiatric exam or a psychological exam.
It is not. No, it's.
Dr. Jackson, does the president do anything at all right now in terms of exercise? What is his daily exercise routine, if there is one?
So I was.
Explain to me how a guy who eats McDonald's and Kentucky Fried Chicken and all those Diet Cokes and who never exercises is in as good a shape as you say he's in.
It's called genetic. Go ahead, right here in the second row.
Me?
Yep.
Oh, thank you. You mentioned that you gave the president a cognitive test. Was that the mini mental state examination or the Boltzmann test? Or if not, can you tell us what specific cognitive test you gave?
It was the.
Thanks very much. Just a couple of things. Do you have a life expectancy range for him based on his results? Number 2, so what exactly does the exercise and eating plan look like? Is it you're going to put an elliptical machine next to the bedroom and he's going to use it? What does that look like? And then also number 3, did you see any evidence of bone spurs, which the president said that he suffered from?
We did.
To 1 scoop of ice cream now?
I don't limit his diet at all. I just I make recommendations.
Dr. Jackson, one follow-up question. There isn't anything that's a part of the president's health records or his overall physical fitness or any medications that he's taking that you're not permitted to tell us? Is there anything you're keeping from us for privacy reasons?
I can promise.
Doctor, can you say, given the president's age, he's somewhat of a peer to where President Reagan was at this time in his presidency. Can you say, given that there is scrutiny of what was overlooked at the time with President Reagan in terms of Alzheimer's and things he was then known to suffer from at a later date, can you say that whether the test that you ran would exclude any of those things and what the possibility of overlooking something like that would be. You know, how can you tell the American people that this time you're certain?
Can I ask you a quick question about PSA? Are you confident of his prostate health? You recited a very low PSA. You're certain that's not a product of finasteride masking?
It may be, you know, I mean,
A waist measurement for the president, his weight, I think he said 239, right? That's, it seems, I think it's just shy of obesity,
It
right?
is, yeah.
So you're confident of that
Yeah.
number, and did you do any measurements?
we don't do any
His age, will you continue cognitive testing in the future? Because of his age, in continuing his physicals in the future, will you also continue the cognitive testing?
That's going to be.
Jackson, it's recommended that most baby boomers get screened for hepatitis C. Did you do a hep C test, or has he had one previously?
Dr. Fig, you talked a little bit about his diet here at the White House. Can you flesh that out a little bit? What specifically is he eating? Is he eating lots of chicken and fishes and white meat? And also, does he take any sleep aids?
Can you say whether your prediction of good health and no serious events for years to come still holds if the president does not make changes to his diet and start to exercise? Is that still your professional medical opinion? And then also, can you just tell us how long the examination was, sort of start to finish, and how many people were involved?
Yeah, so I don't.
Thank you, Dr. Jackson. Was there anything that the president or anyone else specifically said for you not to mention today?
Absolutely. Go ahead.
Just follow up on that. Some of the president's friends have told reporters in the past that they think he's a germaphobe, that he washes his hands obsessively and is concerned about that. Have you seen any indication of that type of behavior being around the president?
No, I mean, he.
OCD behavior along
Doctor,
those
how would
lines?
you characterize the president's health to an average 71-year-old American male?
I'd say.
Just to be clear though, Dr. Jackson, he is taking cholesterol-lowering medication. He has evidence of heart disease, and he's borderline obese. Can you characterize that as excellent health?
I mean,
Potential diabetic changes as a result of his weight.
he has no.
I know
Yeah,
his blood
right.
sugar's real good, but what about potential because of the weight as he gets older?
I mean, yeah,